Welcome back to Today Extra. Now, if you ask women what their biggest health fear is, a lot would say breast cancer. But in fact, they're 5 times more likely to be affected by heart disease.
Yeah, it's a huge problem for the females of Australia. 40% of heart attacks are fatal, but women are less likely to recognise the symptoms and seek help. So for more, we're joined by cardiologist Dr. Ross Walker. Dr. Ross, good to see you. Let's talk about why women are at such risk of developing heart disease.
Well, all of us are at risk of developing heart disease, men and women, and the reason being is that basically we live in a society where there's too much food, we're sitting on our backsides all day, there's a huge amount of stress, and strangely you'll find this a shock, but people are still smoking. So there's so many reasons why all of us get heart disease. It's just that for women it tends to present in a slightly different way, not always, but they don't tend to have the Hollywood heart attack, which is the crushing central chest pain going up to the throat and down the arms. And often they have symptoms that they ignore because, as you know, David, we men are not as good at looking after our health as women, but women are a lot tougher than we are.
Absolutely.
And so that's really the reason. So heart disease is the commonest killer for men and the commonest killer for women.
Dr. Ross, interestingly, new studies have revealed the risk of heart disease is much higher for those affected by early onset menopause. Why is that?
Well, the reason for that, Sonia, is that estrogen is one of the best vasodilators. It opens up blood vessels, it improves your blood pressure, it reduces your cholesterol. And as soon as you start losing estrogen and progesterone, then your heart disease risk starts to increase. And that's the reason why women tend to get heart disease 10 years after men, because they are typically protected by their hormones up to menopause.
So, Dr. Ross, how do you know if you're at risk?
Well, I think the most important thing you see here on the screen, that's a CT scanner that takes a picture of your coronary arteries. You don't need injections, you don't need dye, it just does a thing called a coronary calcium score. All males at 50, all females at 60 should have the coronary calcium score. It is the best predictive test, much more predictive than your cholesterol level.
And what can you do to reduce your risk, Dr. Ross?
Well, firstly, and this is something we don't talk about enough, lifestyle is much more powerful than drugs. So I give people these 5 keys of being healthy. You cannot be healthy and have any addictions. You can't be healthy and smoke, drink too much alcohol, or use any illegal drugs. Number 2, good quality sleep. Number 3, good quality eating and less of it. Number 4, 3 to 5 hours every week of some form of exercise. And the best drug on the planet is a thing called happiness.
Hey, Dr. Ross, before you go, I saw Rosie O'Donnell talk about this because she had a heart attack, and you were talking about the crushing Hollywood heart attack that most men seem to think they're going to have or do have. But for women, the symptoms are very different. Can you let the audience know what they are so they can be aware of it?
Well, the symptoms can be any discomfort from the tip of your nose down to your belly button, and it doesn't have to be pain. It can be just a funny discomfort. It can be unexplained shortness of breath. It can be palpitations. So there are certainly many different symptoms and many different presentations. But what I say to people, if something new has happened in your life that you're not sure about, especially if it's between the nose and your belly button, get it checked out. And there are some other things you can do for your heart apart from just all the lifestyle things. And something that I've become very heavily involved in the last 7 years, I'm the lead researcher in the world in a thing called bergamot. Now, bergamot comes from Calabrian oranges, has a powerful effect on your metabolism, on your risk for diabetes, for fatty liver, but also on your risk for heart disease, and it keeps your cholesterol healthy. So it's my view that all people over the age of 50 should be taking bergamot as a preventative on top of all the lifestyle things as well.
All right, Dr. Ross, thank you so much for your time this morning. There's still plenty ahead for you this hour. Here's what's coming up.